not bring all of the students back into the school building and prioritize bringing special education students back. Well, if you recall, DPSCD was the first school in the country to go face to face with any level of instruction. That happened in July. We worked through that process. We brought our students back to school in September. We work in partnership with our union. That union is DFT. As a part of that agreement with the union, teachers had an option to select whether they would come to school and work, whether they would work with students face to face or whether they would work with them virtually. Many of our special education teachers opted to work with students virtually. So as our learning centers were open, they were also open to our special education students. So students could come into the building. We rerouted staff for students that had more specific needs. We routed district staff to go into those school buildings and offer additional support and assistance. But it has been a challenge across the board. Right now, we close to in-person instruction or face-to-face instruction before the winter break. I call it the winter break, actually the holiday break. We closed before then, or we suspended face-to-face instruction. And right now, we're still in a suspended state. We are anticipating and we're very hopeful that we're moving back to a level of face-to-face instruction with our learning centers opening. Our hope right now, if nothing else changes in the data, our hope right now is February the 24th, which brings us back after winter break. It gives our staff a couple of days to get there and get prepared. And then our students can at least come back to learning centers. And then we would continue to look at where we are with the data, what's happening across the state, what's happening within our area to determine if we would open for more face to face after that. But when our learning centers are open, they are open and available to our special needs students as well. I can't hear you.
Oh, Arlisa, you're on mute.
I'm on mute. How about that? How many times a day does that happen on Zoom? At least 10. I
All
know
the
it's
time.
got it.
All the time.
I am looking forward to the day that we don't have to say that anymore.
I
Right.
know. Well, Ralph Bland, I want to punt the same question to you. With DPSCD uses the term ESC students, but we are talking about special education population. What adjustments have you made? Or have there been any adjustments? And what are you hearing from parents? And what kind of accommodations are being made, if any? And what can parents do to help support the process?
So first, let me say thank you for having me back for the COVID 313.
Thanks
I
for coming
enjoy
on.
being on, and also to the fellow viewers. Like Miss Wright mentioned, it's been very challenging, and especially very challenging for our students and our young scholars. Earlier, it was very challenging during the instruction online, so we actually had students come in to the building for face-to-face learning, and of course, for looking for the making sure that we're staying in tune with their IEPs and also talking to Wayne County Research and making sure that those services continue to stay available. One thing that was very critical is that we started doing, of course, home visits. And after our home visits, we had at least 85% of our students join us, and their attendance went up. In the beginning, attendance was a little low, but once we started doing the home visits, it continued to go up. We also tried something a little different to meet students and families in different areas of the city to do face-to-face instruction and get them out of the home where they could be a little bit more engaging and so they wouldn't be in front of a screen all day. In addition to that, we were able to create our resource backpacks where we put different supplies that students would need at home, as far as maybe a small dry erase board, math book, some manipulatives, crayons, pencils, papers, and some other school supplies, and had those parents pick them up. We also drop those off because those are usually supplies parents don't have at home, so they can create their own learning environment at home. So, in addition to that, if they ran out of those different materials or supplies, they were able to come back and we were able to replenish the backpack. In some situations, we had to go out to the home to do that, which is fine. And we continue to do our our home checks, where we go over the homes every week, if not every other week, to make sure families need anything that they might be able to they're having an issue with. And in addition to that, students are still receiving their services as far as occupational therapy services and things like that. That's also continued to be implemented. And even though it's
Thank
kind of
you.
difficult, but it's being implemented through Zoom.
Okay, thanks. Christine, you want to?
So I want to, oh, yep. I want to remind everyone in the audience that they can ask questions. So please put your questions in the chat, the Facebook chat, or text them to us. This question is really around, and this is, Ralph, since you're off mute, why don't we have you go, and then Ironetta will have you answer it. But what can parents do to help and partner with the schools and their students' teachers to better support their children at home? So this is really about, like, how can parents better partner? What would be your advice to parents around that?
Definitely, I think it's important that the communication stays open, and finding out what's the best way to communicate with the teacher or the school. I think that's going to be real critical. And in addition to that, uh, also it's going to be critical that sometimes the parent is not going to be able to meet with the teacher during the hours that are available during the day. So I think it's going to be important that uh, our schools are flexible enough, which we are doing, where they can meet parents in the evening if they have to catch up on communication. And also, sometimes we try to take these large chunks and large steps as far as lessons to break those chunks up to smaller steps where parents will be able to give their child better support at home. But I think definitely the number one thing is communication. And in addition to that, we've actually had parents come in. This is another option. They could come in one on one and to meet with the teacher, with the student, to see how the teacher gives the instruction and also give the parents some pointers. I think that's critical, even during this time when we're not having a lot of students come in doing face to face, but we are allowing students and parents to come in so we can do assessments and things of that nature. So making some one-on-one appointments, I think, would be very important.
Go
So
ahead,
I
Ironetta.
Sure. I would actually have to concur with everything that Mr. Bland said. We opened our family and IT technology hubs, our family and technology hubs back in December 1st. Since that time, we've seen about 12,000 families that have come through the hubs. In terms of services at the hubs, not only do parents have access to technology and getting their devices repaired or getting loaner devices, but they also have access to our family and community engagement team as well as support for instruction. So that is open. It's open daily. There are 13 sites across the city. On Wednesday, that's a late day, so they're open until 7 o'clock on Wednesdays, and we're also open on Saturdays. We also have, in terms of support for families, we have an online homework hotline that's also that we have special education teachers that are also on the hotline as well. So if parents are working with their children and children are needing additional assistance, they can call the hotline and get a person to actually speak with to help them walk through some of the concerns that they're having. We also offer that for mental health support. So I always have to share what we're doing for mental health support as well. I think the third, one of the things that Mr. Bland shared as well was looking at evaluations. So we've continued to work with students through evaluations during this time, making sure that we have 5 sites that are available across the city where evaluations for students don't stop. So we have 5 sites where our teams are there to continue working with our special needs evaluations to give families that level of support. I think more than anything is the open communication with the school collectively. Um, as we are all exercising grace, and we do ask parents to also give themselves grace because we've been dealing with this since last March. All of us have, and all of us were put in a situation where we were figuring it out and trying to figure it out together. And so I would encourage parents, as a parent myself, I would encourage parents to please give yourself grace. Recognize that this is new for you. And even though you started in March and you're trying to figure it all out, we're still working through this process together. Communicate with the teacher and share with them what the best platform is for your child. So while we are working virtually, we are looking forward to reopening our learning centers because we know what a value that was for many of our families. But we were also honest at the very beginning that we would suspect that some students would increased. And at the point that they increased to that level, it was important that we shared with our families that we were going to honor the commitments that we made to them. So if the virtual platform is not working, if your child is not one that's able to access the virtual platform, and it's better for your child's teacher to call them on the telephone, our teachers have been doing that and they're willing to do so. When we were in more of a face-to-face environment, we would have teachers that would go to schools just to meet with their special needs population. So we do have to offer kudos to our teachers because they're learning through this as well. And they have really worked hard to be flexible and they want their students to be successful. So really talking to them. If for some reason you can't reach a teacher, we have administrators at the school. Contact the principal. If you cannot reach the principal, and that would really concern me if you could not, but if you cannot reach the principal, email Dr. Vitti or I, email us so that we know and we can really help you work through that process.
So Ironetta, can you put your email in the chat so that we can put it in our chat? Because I think that that's really, really helpful. Just a follow-up question, if you have an exceptional student and you're calling the homework hotline, should a parent specifically ask for a teacher that works with the exceptional student population?
I think that our teachers collectively are equipped to work with whoever calls in, but I did want to call out that sometimes, many of our special needs students are working on a regular ed curriculum. And so if they're working on a general ed curriculum, they may be receiving accommodations, but not necessarily modifications. So through those accommodations, a general education teacher can give them feedback on what they're doing in their general ed lessons. If it's something that's more specific or more unique, and we feel that we need to have the support of a special educator, we have them available on the hotline as well.
Great, thank you. Arlisa, do you have a question you want to ask?
Yeah, there were a couple questions that had come through, and then I'll start with you, Ms. Wright.
Okay.
How are, and please forgive me if this has already been answered, I don't think it has, but they wanted to know, how are IEPs currently being done and conducted? And I'll also have the same question for you, Ralph. How are they being conducted in this virtual space we're doing now?
Right. So we thank you for asking that question. We actually started back in March in partnership with our work with Wayne Risa to do our IEPs in a virtual space. So we are continuing to hold IEPs, to hold IEP meetings. Most recently, we added additional technology so that IEPs could be signed virtually as well, so that it did not require for there to be the face-to-face meeting for the IEP meeting. So really, we started that since last March, and we've just continued that process. We trained our teachers last March on how to do the IEP in the virtual space. Parent gives access or gives permission, and so they can either do it virtually on the computer, they can call in on the telephone and do it through a conference call as well. So that's really communication that they want to have with their case manager, and the case manager is just a fancy word for the teacher that is overseeing the IEP, the special needs teacher that's overseeing the IEP. But I do want to also add, and I heard that Mr. Bland referenced this, we are still bound to offer student services based on their IEP. So just because we are in a virtual space, we have to modify what that looks like. We have to be flexible with what that looks like, but to the best of our ability, we're still offering students the services based on their IEP.
And Ralph, the same question for you. How are you all doing IEPs?
Uh, Definitely, Miss Wright hit it right on the head. That, excuse me, she hit it right on the head about holding the IEP meetings virtually, but also reaching out to parents face to face if necessary, but also communicating with them on the phone. Definitely following the IEP, that's very critical and important, even though it might present some challenges, but we still have to follow that.
Good. Christine, do you have any audience questions? I think I saw some coming through. If you want to ask.
Yeah, I do. I do. So, one question is, I've been messaging my son's teacher and I've had no response. What can I do? I'm not, it doesn't indicate whether it's a DPSCD or a charter school student. So what would you recommend to this parent who has struggled to communicate with the teacher?
I think I shared this earlier, but I would always say reach out to the school's principal. If you have, contacted the teacher, it's a new platform for teachers to really communicate back and forth in the chat on Teams. And so often what happens, we find, is that parents are trying to communicate with teachers through Teams within the chat for their students' classes. So if they sent them an email, we want to make sure that that communication is through email. So if they sent them an email and they've not received a response to that email, please follow up with the principal of that school. On our district's website, we have all of our schools listed. It gives you immediate access to their email address. So all you do is go to your school and click the principal's name, and it will take you right into your box to send them an email. So that would be the thing that I would recommend. And then if you've done that already and you've not received a response, I did drop my email in the chat as well because we want to make certain that you get a response.
Ralph, what would you say to this parent?
Definitely reach out. If you can't reach the teacher, definitely reach out to the principal. Definitely that would be key, but also our student support managers that are at every school that focuses on supporting students, regardless if it's behavior, attendance, or academics. Our student support managers are really, they really built good relationships with families and parents, and so they can actually get out and even do home visits and take that message back to the school, to the principal. But we want to make sure that we're getting in touch with our families, and if we haven't heard from a family, we're going to go out to the family's home to see what's going on. So we're trying to be proactive about it too.
Great. Um, so this is, and you might hear some background noise. My son is practicing his reading. Head sprouts. So why can't teachers use one platform? It's hard to manage all these different platforms. So do you have, I'm smiling because it's, I'm a parent, it's a lot. So how do you ease this pain for us parents here that are trying to manage all these platforms?
Is that a DPSCD question? Is that one for specifically for us?
The person is not specifically saying, so I don't know. But if you feel like it's about you, Ironetta, about DPSCD, go ahead and start.
Mr. Bland, are you using a variety of platforms in your schools right now?
Okay, I like that question, Ms. Wright. Thank you. So we're using one platform. I think it's important for the platform to be consistent because if the platform is not consistent, then that's when different things happen, like a virus, or sometimes you get student hackers that might be outside of your school district that like to come in different classes and cause a little disruption. But overall, it is important to use one consistent platform, and it cuts down on different technology issues or interruptions that families and students may have. And we're actually using Zoom, and that we've been real consistent in that. And in addition to that, we're using Chromebooks, and it's important. We feel it's important that families use one consistent technology tool if they have it, versus getting on with a phone or a different type of brand of computer. And it also cuts down on technology interruptions.
So I will answer the question as well. So I think we know that we service a little over 50,000 students in the district right now. And therefore, our platform, as we were looking at which ones we would use last year, we really went to platforms that had a higher level of security clearance for the platform itself. And so the platform that we used initially was Teams. That's where we started. It's an Office 360. It's a Microsoft product through Office 365. Currently, we are using Office 365 Teams, and we're also using Schoology because Schoology was really a learning management system that allowed for all of the students' information to be in one place. We've received a lot of feedback on that. And so just last week, actually it was the beginning of this week, we started with our online learning task force that's really addressing that question right now. There's been a lot of field feedback that's come from the field, that's come from teachers and their concern with having more than one platform. It's come from parents and their concern with having more than one platform. And is there a particular platform that seems to work better for our primary students than a platform that works for our older students? So I would say that as we're moving forward, and then the integration of grades, so that becomes another platform, so to speak, because we're using the grade portal. So our online learning task force, that's really one of the questions that they will be tackling as well, and really getting to the core of what works best and the best way to integrate all of those. Schoology does have the functionality where it can be integrated with the grade book. In a larger district, that's come with some challenges. So we're working through that directly with the Schoology team as well. I would say at this point, the communication with the teacher is really important because teachers are selecting what they choose to use that's the most comfortable for them and their students. So really communicating with the teacher and using the resource as the teacher has recommended. We do know, however, that as we move into next school year, we do believe that there will be some level of virtual learning that will be necessary for our students and families moving forward. We don't believe that even with the current vaccine, that all of our families are going to be comfortable returning to a brick and mortar building. So we want to have resources available for them. And so we'll spend the time through the year refining that process so that as we continue to go into our next level of online learning, we're doing that in a way that there is a resource that parents and students and teachers feel comfortable with.
So Renata, so it sounds like you all are really looking at this question about multiple platforms, and that there's a potential that you're trying to solve for, kind of the clunkiness and the frustration of having multiple platforms. In terms of communication with teachers, is it the district's expectation that teachers provide some sort of mechanism for parents to actually call them if they're not comfortable with technology? I was reminded yesterday, sometimes it's hard to chat. I was trying to get my son on to a test and it was not working. And eventually the teacher was like, just call me. And so is it, and that is actually how we worked through it. But it made me think, parents that aren't comfortable in a chatting, or on an online platform, is it DPSCD's, I guess, expectation of teachers that there's some sort of telephone communication for the virtual learners?
Yeah, so we have offered additional support through our online help desk, where we staff that help desk all day during the school day. Now it's not staffed like our homework hotline and our mental health hotline, which are staffed through the evenings. But the online hotline is staffed throughout the school day. And so we have individuals that are on. Not only can family members receive support for online help at our hubs, they can also still call our online hotline where they can receive support right then. We really would have to make sure that there is communication with the teacher in terms of the call-in process, because there is the option through Teams to make a phone call, but we also don't want families calling in during the class time, so that they're then interrupting what's happening during the school day. We know that they would not want that, and the teachers, it wouldn't be appropriate for the class collectively. So there, we would really think that the communication between the family and the teacher would be important. The other thing with that in terms of access is, and we are placing this on it's on each of our individual schools' websites, but we are placing this on our district website as well, is each of the principals has office hours weekly. And I say principals, but that's really principal support group. So that could be the principal, it could be the assistant principal, it might be the guidance counselor, but that is also a good time to call in and get school specific questions answered or school specific assistance. So if you're trying to reach if you're trying to reach teacher Miss Bell and you've not heard back from teacher Miss Bell, that would be a good time to call in also. And that's actually published on each of our schools' websites.
Great. That's such great information. Last question. This is from a DPS CD teacher. And then, Arlissa, after I'm done with this question, if you have any follow-up questions on your end. But I'm a DPS CD teacher. Where can I get the COVID vaccine? And Ironetta, before you answer that question, the health department is going to be on after you and Ralph. And so the teacher, hopefully the teacher is still listening right now, and you'll be able to get more information about the TCF process. But Ironetta, I'm not sure if the district has some protocol around vaccine and where you're sending your teachers for that.
Yes, so if it happens to be a teacher with DPSCD, they have access to our intranet, which is where it's our platform for everything communications for our district employees. On that, and it's called the Hub. Once teachers go into the Hub, the very first, and when you log on, that's what you see. And in our district, when you log on to your computer, it takes you to the Hub. Once you get on the Hub site, on the very first page of the Hub, there is down the right hand side of that page, there's all of the information there and available about the vaccine, about where teachers can go, about how they do the scheduling. So that information is there and available. It's on our hub site, and it's also on our webpage as well.
Thanks, Ralph. Where are you having your teachers go and school staff go for the vaccine?
Right now, they've been going down to the TCF Center for the vaccine and making appointments. But we also are sending out information weekly to our teachers on where they can get the vaccine if they want to. But in addition to that, we've actually been been supplying and been able to supply teachers with COVID testing at two of our sites, not just for our school staff, but also for the entire community, hoping to slow the spread. Um, and in addition to that, that it's been very important that our teachers are in the building now. So they were COVID tested earlier before they returned in January to make sure that we had a safe return. So they're doing distance learning from their classroom with their students, and we hope to get the students back into the building around the first week in February, depending upon the infection and positivity rate that's in the community.
Great. So I know we are up on time. I do appreciate something that you said, Ironetta, about giving ourselves grace as parents and also our school systems. Ralph, the academies that you're running, as well as DPSCD, I think as parents, we also have to give grace to our system because this is very different. We've never gone through this before, and I appreciate it. I am a DPSCD parent. and I'm also a part of the task force, and I do appreciate being able to have a way to be able to communicate and connect with other parents and other teachers about what works. And I think that's the way that we get to resolving some of this, is constantly getting feedback from our community. So yes. So, but I think that's it for us. Christine, if there are additional questions, we will
I
pass
have
them
one more
along.
thing.
Is that right?
Yeah.
Oh,
We will.
Arnetta,
We'll
you want
pass
to
it
say
along
something?
to you. Yeah, go ahead.
I think.
I do. I just want to add one more thing. I did drop into the chat the link to our Exceptional Student Education webpage. We do have monthly a parent advisory council meeting that is specific for special education. And so we are always looking for parents to attend that. We're looking for additional members for that meeting. The next meeting, I believe, is February the 9th. But if you go to this link and just look for Parent Advisory Council. The information for how to log into that meeting is there. All the meeting dates is there. And we look forward to our special needs parents logging in and giving us feedback directly as a part of that parent council meeting for what we can do to continue to support our students. Thank you.
Great. Thank you so much, Ironetta. And next week, we'll be talking about bilingual education. And we are so grateful to have both of you here with us answering questions and being brave to answer questions that you do when you don't know what's coming. So thank you both so much for all you do every day for our kids. Thank you. Jametta?
Thank you. And I just want to echo what both Arlisa and Christine were saying about being grateful for the work. And as we think about that, one of the things that you just said, for example, Ralph, about you're making sure that you're constantly testing. And so we're really grateful that you as a school leader, certainly Dr. Vitti and his team are making sure that the Wayne Health mobile units are out there consistently, because working together, that's what it's going to take for us to slow the spread. But when I use those words like slow the spread, mask up, 6 feet away, immediately I am sure that you're thinking about the messages from our public health experts and our public health officials, and who understand science and are bringing it to us to keep us safe. And so we're pleased to be able to have back on the program representing the Detroit Health Department is Hannah Ewing. I had the pleasure of meeting Hannah, in fact, last evening, where she was part of DPN, did a Healthy Parents Cafe. And Hannah is the Outreach and Education Manager for DHD. And we welcome you to the COVID313 Community Coalition in Town Hall. And please give us some updates on not only COVID as it exists, but then if you could, we want to also hear something about the vaccines as well. Hannah.
Absolutely. Thank you guys so much for having us. We love engaging with our community, and events like this are just what we are here for. So I'm going to talk about our COVID-19 updates. And I also wanted to give a shout out to our educators. You guys are working so hard. My sister's a school psychologist out of state, and just seeing what she goes through, I have so much respect for you guys. So just a thank you from the health department to all of our educators out there. Next slide, please. So let's talk about our current case situation. Detroit, as of a couple days ago on the 26th, we had a total case count that's from March 11th onward of 28,377 with 1,781 confirmed deaths. We have our positivity rate, which kind of gives us an idea of how we're doing overall. We saw it kind of increase in November and December, and now we're seeing it come down to 4.8% in the city of Detroit. And if you look at how the city of Detroit is doing in comparison to our neighbors in Macomb and Oakland County, we are doing a really good job, much lower rates. This is because Detroiters are taking care of each other. They're masking up, they're washing their hands, and they're continuing to social distance. And if we want to continue on this downward trend, we need to continue to do those things along with good testing. Next slide, please. So you may have heard about the 2 COVID vaccines. There are 2 EUA, which is an emergency authorization use vaccines, which is the Pfizer-BioNTech vaccine and the Moderna. Both are shown to be highly effective at preventing COVID-19. COVID-19 vaccine will help you from getting COVID-19. Another benefit of getting the vaccine is that it is a safe way to help build protection. Additionally, the COVID vaccine will be an important tool to help stop the pandemic. And what we say tool is that it's not going to be our answer to everything. It is one of the many things we're going to do to stop the pandemic. So we still need to wear a mask, socially distance, wash hands, and be diligent to protect our community. Next slide, please. So who is eligible to get a vaccine and where can I get it? So the City of Detroit is offering COVID-19 vaccines at the TCF Center. There is no cost for this vaccine. And as the vaccine supply is currently limited, we have some restrictions in place. So we want to talk about who is eligible to get the vaccine today. So any resident of the City of Detroit who is 68 years or older, that means anyone born in 1950 or earlier. Additionally, our wonderful childcare providers and K-12 school employees can also get the vaccine at the TCF Center. Our U.S. Post Office employees who live or work in the City of Detroit can also get their vaccine at the TCF Center. And employees of the City of Detroit or city-related agencies who are working from their regular job site. So if you are going into work every day or a couple times a week, you can get your vaccine. But if you are still working remotely, you cannot get your vaccine at this time. We also are including federal, state law enforcement officials who live or work in the City of Detroit. These include our FBI agents, our ATF agents, our DEA agents, our U.S. Marshal, U.S. Attorney General, State Police, and Michigan Attorney General, as well as active members of the clergy who live or work in Detroit, who are actively engaging in face-to-face contact with their congregate members. And in order to be approved to get the vaccine at the TCF Center, if you belong in that little section, you have to bring your ministry ID with you to your appointment. We are also offering vaccines to funeral home and mortuary services, employees who live and work in the City of Detroit. Next slide, please. All right, so if you are eligible, here is how you can make your schedule to get your vaccine. You're going to call us at 313-230-0505 Monday through Friday from 9 a.m. to 6 p.m. And I will put it in the chat so we can share it with everyone participating in this conversation. When you call, you're going to choose prompt 1 to make an appointment for the vaccine option. You're going to give them the following information. Everyone is going to give their name, their date of birth, their home address, their phone number, and email. For others, if you do not fall in that 68 age group or older, you may require some additional information. This includes things like a pay stub, your employer name, your work address, and things like that. So make sure that when you get your vaccine, you bring all of that information to the appointment with you. When you call to schedule, you don't have to worry about making your second vaccine appointment. We're going to schedule both of them at the same time. And reminders about your upcoming appointment and instructions will be sent via email and text, so you'll have a reminder of when your appointment is. And make sure too, if you do not fall in these categories for the vaccine, to check our website, and we will be updating it consistently. Next slide, please. And next slide, please. And so this is what to expect. I know I hate going to the doctor sometimes. I get very anxious. So we want to describe what it's going to be like when you go to the TFC Center on your appointment day. So please try to show up on time. I know I like to be a little bit early, but if you are one of those early people, try to show up on time. If you're late, try to leave a couple minutes early so that you get there on time, so that we can make sure that everything flows smoothly. Additionally, once you get to the TCF Center, you're going to verify your eligibility. So show them all of your paperwork, your ID. You're going to be asked if you have any allergies so that the medical staff can make sure that they are providing you with the best care possible. Please anticipate about an hour for this process. And plan to remain in your car for the entire time. Additionally, we know it's very cold outside, but try to wear a short sleeve shirt underneath your jacket so that you can show everyone your arm when you get the shot and you don't have to worry about your clothing. And as a reminder, the TCF Center is open from 9 a.m. to 5 p.m., which differs from our call line, which is open from 9 a.m. to 6 p.m. Next slide, please. And I love data personally. So we want to be as transparent as possible at the health department and show you how many vaccines we have and how many vaccines we have in our positions and are going to give. So currently we've given, we have 18,450 vaccines. 13,000 of those are Moderna and just over 5,000 are Pfizer. And actually, as of this morning, we've actually given up 81% and not 75. So we're improving on the number of vaccines we have given out. And a lot of people are wondering, who are you vaccinating right now? We've vaccinated over 2,000 of our K-12 teachers and our wonderful support staff, in addition to over 5,000 of our 70 plus residents and good neighbors. And if you want to check up and see how we're doing with our vaccine, this dashboard is available on our website, and we will give you that information in the chat. Next slide, please. And just as a friendly reminder, I absolutely love this picture of how we are going to take care of our community during the pandemic. So the vaccine is just one example and one tool we have in our toolbox. So we can help slow the spread of COVID-19 and end this pandemic by our COVID vaccines, but also continuing to wear our face mask, social distancing, and practicing frequent hand hygiene. And just remember that stopping the pandemic requires using all of the tools we have available. It's the combination of getting vaccinated and following CDC's recommendations to protect yourself and others that will offer the best protection from COVID-19 and help keep our Detroit community safe. Next slide, please. And this is our information on how to reach us. We also offer individualized education. So if your community group or your neighborhood would like specific information, you can email us at dhdoutbreak@detroitmi.gov. And we are happy to meet you virtually or in person using social distancing to make sure that we are reaching every single Detroiter and getting you guys the information that you need. Any questions?
Thank you,
We have a
Hannah.
few questions.
Yeah, great.
Oh, sorry.
No, go ahead. I was going to say,
We have-
Christine, do we have any questions? I'm sure we do.
We do.
Uh-huh.
And I'm looking at the time. So, so one of the questions that I think is that you didn't answer in your presentation that came in was, if I get COVID-19, will I still need to get the vaccine? Do I still need to get 2 doses?
Absolutely. That is a great question. So as someone who's had COVID-19 personally, I got vaccinated according to the CDC recommendations. And they are still recommending that you get your 2 full doses. So if you get if you get Pfizer on your first vaccine, you're going to get the second dose of Pfizer. If you have any additional questions too, you can always consult your health provider, but the recommendation is, because COVID-19 is so new, to get vaccinated even if you've already had the virus.
Great. And one more question. If I get the COVID-19 vaccine, should I wear a mask in my house? I have children and I'm afraid of somehow passing the virus along to them.
That's a great question too. So unfortunately, we don't know if once you are fully vaccinated that you can give COVID to other people, but the vaccine does not give you COVID. So if you get the vaccine, you are not going to spread COVID-19 to other people. It'd just be like if you're wearing a mask in your house normally. So if you get the vaccine, you are not going to be infected with COVID because of the design of the vaccine. It does not, and you don't get the live virus into your arm, if that makes sense.
That makes total sense. Jametta, that is all the questions that we have. And so I'm going to pass it on to Jametta. Thank you so much for being with us today. This was amazing information.
Of
Yes,
course.
and thank you, Hannah. And if you would, families, we want to let you know that you have in the chat, you have information from New Paradigm of a mobile testing site at his locations that's there. We'll also make sure, Hannah, we would love to have your slides. We'll keep them posted so that you can get this information. We just do want to emphasize that whatever we're seeing on TV, it doesn't matter whether it's national or if it's cable, please make sure that you are looking to see what is happening in Detroit, because Detroit is not the state of Florida or some of the chaotic things we've seen in other places. So we want to give a shout out and deep appreciation for the level of way things have been organized as best you can while we're waiting on more vaccines. So thank you so much. And thank you. As we're moving forward, speaking of the state, as I mentioned earlier, our Governor Gretchen Whitmer, very early in this pandemic, as many of us saw clearly that it was indeed African Americans in particular, as well as Latinx, Indigenous, Native American communities that were hit disproportionately so by COVID. And we know that's for a variety of issues. So what she very quickly did was pull together a statewide appointment of people to the Corona Racial Disparities Task Force. And I'm happen to be blessed to be a part of that. And I'm delighted to welcome to the program another colleague in this very important work, not only in terms of addressing health disparities in the pandemic, but health disparities and repression overall. And that is Dr. Marietta Daniel Eccles, who is joining us. She's a part of the task force, but she's also co-chair of what's called Centering Equity. And there's been a lot of things that you've been talking about. What is this notion of equity and what are some of the things that have evolved? But first off, Marietta, welcome.
Oh, thank you for having me. I'm glad to be able to be in dialogue with you all today. And then could you repeat your question? What is the concept of centering equity? Why centering equity?
Yeah, so, we had a lot of different committees we came up with.
Yes, we do have a lot of different committees. And I'll tell you, the task force, you said it well when you said, there was these huge health disparities and Black and brown folks were dying of COVID at disproportionate rates. And when we came together, as you know, Jabetta, we were very laser focused on certain things. We need folks to get tested. We need to explain to them about social distancing. We need to do contract testing. We need to stop people from dying of COVID. And the other part of our work that is expressed, if you look at the executive order and what the task force is tasked to do, is to also figure out the root causes that led to that disparity, and also think about how do we address those as well, so that, God forbid, we have another pandemic, we don't have these same disparities, and to address the root causes that led to the disparities. So for us, what that means and why we decided to center equity, and my co-chair of this work group is Renee Kennedy, who runs the Michigan Public Health Institute. The root cause of this is systemic racism. Mm-hmm. And systemic racism, which then leads to differential access to what public health people call the social determinants of health, but is what we know to be all the things that we need for our children and families to thrive. Access to transportation, safe and affordable housing, access to nutritious and affordable food, living in communities that are safe and free of crime, access to high quality education, all the things that all of us want and our children and families deserve. We don't all have equal access to it. And so for us, getting at that root cause of systemic racism and, for example, our governor declaring racism as a public health crisis and saying explicitly that we as a state need to face the impacts of racism on our families. That's really what that Centering Equity work group is all about. How do we focus on some parts of the work and things that government can do, policies and practice changes that get at systemic racism?
So that focus on equity, and could you just for a moment explain from your perspective, what are we talking about when we use the word equity and we're
Mhm.
talking about the health and well-being of our communities?
Sometimes people hear the word equity and they think equal. Equality and equity are not the same thing. Equal is just kind of what we learned as children. When we thought what was fair is that everyone gets the same. And if your piece of cake was bigger than my piece of cake, that wasn't equal and that wasn't fair. I should use a different example. If your bowl of broccoli was a different size than my bowl of broccoli, it wasn't equal and it wasn't fair. The equity concept is about people getting what they need. So maybe I didn't need as much broccoli as you. Your nutritional needs are different than mine. So you getting more broccoli than I did was exactly what needed to happen so that we both get our needs met. And so we really need to be thinking about, what do our children and families need to thrive? And it doesn't mean it's equal. It means, what do you need? What does your child need? What does your family or community need to thrive?
So as we think about that, there's been some recommendations that came out
Mhm.
of the work group. One of them on the assessment. The other one is that we hear a lot about this word implicit bias. Could
Yeah.
you talk a little bit about, what is that, and who cares? What's the point of that, right?
Right. So, yes. So, one of the things that has come out of the work that lots of folks have been doing is um, an executive directive that the governor put out that makes implicit bias a requirement as part of licensing for a broad spectrum of healthcare providers. And it requires them to get training as part of getting or renewing their license. And implicit bias, it's really kind of the stereotypes and the things we have in our head that we walk around with all the time and don't even necessarily know that that's how we're moving through the world. When you think about the ways that oppression shows up, there is that interpersonal piece, which I call that the kind of the get yourself together piece. It's what's happening internally. It's your thoughts, whether you know it clearly or if it's implicit of how you're moving through the world. There's the personal and there's the interpersonal, how you engage with other people. But then there's also institutional forms, and there's also what we call systemic. And all four of those things, the personal, the interpersonal, the institutional, the systemic, they work together to form, um, to weave together a set of oppressive policies and practices and way we move through the world. And implicit bias is really like, it's the beginning of that process, because we have to make ourselves aware of how we're passing judgment on people in our head and not even realizing it. And then once we realize it, we're like, oh, so what else have I been doing on autopilot and not thinking about it? Why did I cross the street when I saw that brother with the hoodie coming at me? What was that about? And so the implicit bias are the things we do that we've been conditioned to do because we live in America. And we live in a white supremacist society that has implanted some things. And so that implicit bias training is important because it makes us check ourselves. And in healthcare, it's very important because what we know to be true is that health outcomes for Black and Brown children are in fact impacted by who is their healthcare provider. And some of that implicit bias assumptions that healthcare providers bring to the provision of care can negatively impact our children. So we need them to do better and be more aware.
So absolutely, and in some ways, this section coming very close after the discussion about education was really important, because the reality is that we see how structural racism and those autopilot biases that we have affect not only how we educate our children and families, but how we even perceive their health needs and then respond to that.
Right.
So thank you. I think there's a lot more that we could probably talk about, but I want to create an opportunity in the event that we may have had any questions as people think about the requirement now to go through implicit bias training and this discussions about assessing the needs of organizations to make sure that they are less racist, which is a whole other conversation. But let me
Yeah.
open this up. Christine, do we have any other questions?
We have not gotten any questions as of yet, but I would love for you to talk a little bit more as a parent. If you could talk a little bit more what you would suggest to parents in terms of looking for a healthcare provider, so that you're picking a healthcare provider that, because we know that trainings are trainings, and sometimes trainings don't move people to act differently.
Yes.
And sometimes people disagree with them, right? Particularly when we're talking about this, because this is a journey in which it's a personal journey that you have to go through to even get to a point where you're willing to recognize that this is this is real and truth. So what would you suggest for parents in terms of looking for a healthcare provider that can treat their children in an equitable way?
You know, one of the things that I think we sometimes forget as parents when we're going to the doctor or trying to find a doctor is that we are, in fact, the customer.
Yes.
we are, in fact, the experts on our own lives and our children's experiences. But we don't necessarily always feel like we can be that expert or be that authority. And honestly, sometimes it takes practice to kind of get yourself ready to go in there and be that advocate. But we always have to remind ourselves that we are our children's first and best advocate. And so part of finding that physician or that pediatrician that you think kind of understands your family, there's going to be some trial and error. When my children were young, I've had experiences with physicians that were problematic. I had a pediatrician once call my child a cute little monkey. And I was like, what is happening? But you know what I did? I found a new pediatrician. That was the last time I'd interacted with that pediatrician. So part of it you might, and some of this is also about kind of how much time and access and privilege you have. That's part of how some people are able to find better doctors than others. It requires some shopping around. It requires you to be able to be in conversation with a physician, to ask them questions, to find some things out about their background, to see if they even want to ask you a question. Because the physician who will stop and take a minute and actually ask you, how are you doing, and try and find some things out about you is far more likely going to be the physician you're going to want in case of real crisis or illness with you or your child. So it's talking to your healthcare providers, it's not being afraid to be an advocate, it's being okay with saying, you're not the right one for me.
Right.
And going to the next one.
Christine, I suspect that we could do brain drain on Marietta around this for quite a bit of time. And certainly as a program officer with the Kellogg Foundation, it's wonderful that you bring this opportunity. And we want to actually open this up to our families, that we want to have more conversations about how to be an advocate, not only for our children in healthcare and education, but how during COVID, we have to be advocates in healthcare. So Dr. Eccles, thank you. It was a joy to have you with the program. We want to have more. Christine, I know you've got 72 questions. I got about 12. But in the background, I've got folks saying, we got to move, we got to move.
Yep.
This is always our challenge. Again, thank you so much. But we're going to continue with our next section, which is, we were just talking about health. But when we talk about health, we're also talking about our social, emotional health, our mental health. And so we're really pleased to welcome to the program Keisha Jackson from Caleb's Kids. Welcome, and talk to us about what Caleb's Kids is doing to help us think about how to support the emotional development of our children.
Thank you. And so, again, I'm Keisha Jackson from Caleb's Kids. And what I wanted to talk about was just the mental health supports for families. So Caleb's Kids is an organization, a nonprofit here that focuses on that mental wealth or mental wellness piece and mental health education and suicide piece specifically for our young people and parents and the people who support these young people. Next slide, please. And next one. And so as we look to some of the concerns that we've seen over the last year, we have seen depression and anxiety being those top concerns, as well as the additional concerns with worry, fear, stress, sadness, and just overall concerns from grief and loss. So I wanted to talk through a little bit how to cope with these things, how to manage these things, and just some practical steps we can take as families to help work through some of these challenges. Next slide. So some daily practices, and these are things that you can do anywhere because they're mostly centered on self. So being kind to yourself, there is a lot going on. We have to make sure that we're patient with ourselves. Things that we did last year at a certain pace, we're certainly not doing it this year at a certain pace or at that same pace. It may take us longer to do things if we're able to do those things at all. So just being kind with ourselves, giving ourselves grace. But also what's really important is don't be afraid to take a break. Don't be afraid to give yourself some of that time that you need, which may be difficult with all of us being inside of the house, all of us sharing the same space for work, school, or whatever it is that we need. But even if it's simple as just taking 5 minutes of time to tell your children, hey, this is my 5 minutes, I'm taking this time to myself, or even 5 minutes in the bathroom where you can take some time to yourself away from everyone. And just creating a new routine for self-care and a new routine for that overall wellness that really incorporates all of the things that we have going on right now. Next slide, please. So one of the things that we do is we look at what we're eating and we look at food. Food and what we're eating is extremely powerful. So here are just some examples of some things that you may have in your cabinets, you may have in your kitchen that really can help enhance your mood. Things like dark chocolate, honey, oatmeal, drinking your water are all things that can really help to enhance your mood and really create almost a wall against everything that's going on in our external environment. Next slide, please. And then just some additional coping practices. When we think about coping and dealing with just the impact of everything going on, we have to figure out what works for us, what makes us happy, and what calms us. It could be something as simple as talking to someone about everything that's going on, journaling, going outside and breathing in some of that fresh air. Having some type of activity, whether it's a physical activity where you may walk around your home at a quick pace, or you may walk up and down the stairs at a quick pace, or go to the gym if that's an option for you. And then just practicing those things that can really help to work through everything that's going on and help you focus on what's in front of you and not all of the negativity. Next slide, please. And then there's professional help. So let's say you're doing these coping mechanisms and you've tried yoga, you've tried running, you've tried journaling, you've talked to your friends, talked to your family, and you're still struggling with, how do I manage things? What are the support that I have? There's professional help for you. So counselors, therapists, psychologists, trauma specialists, psychiatrists, all that really can help manage that mental health piece to really restore what's going on and restore balance. Next slide. And then these are just some additional resources for help. On the left-hand side, there are some 24-hour resources, whether you like to text, whether you like to talk on the phone or chat on the phone or chat on your computer, there's a resource on the left-hand side to meet you at whatever you need and whatever you're comfortable with. And then on the right-hand side are just some local resources. Of course, there's a Caleb's Kids website, which is my organization that we do a lot of work around the mental health piece with youth. but also the Reach Us Detroit website that offers therapy services for young people and families at no cost. And then we have the Michigan Stay Well websites, the coronavirus websites, and the headspace.com website. What I want to point out about the michigan.gov websites is that it helps for whatever your need is. So if you need resources for financial concerns, resources for childcare, resources for mental health. So really helps all those things that impact our day-to-day operations and our day-to-day beings that have been proven to impact how we feel and impact our mental health as well. Next slide. And these next few slides are just a few apps. A lot of us use our phones a lot. A lot of us use these tablets a lot. So there are a few apps that are of no charge that can kind of help you in your journey for really managing what type of mental health resources are there for me, are there for my family. And there are a variety of topics, suicide prevention, just overall mental health, any type of addiction. Next slide, please. As well as anxiety, depression, and then just the mindfulness and meditation. So these are just resources that can help manage everything that's going on. You have apps that are free, but then you also have the local resources, the state of Michigan resources, as well as some national resources. Next slide. If you guys are ever interested in connecting with us, we are always hosting informational sessions, passing out resources, workshops for young people as well as parents. You can contact us on social media. We're always here to help you. So thank you. I'm Keisha Jackson again.
Keisha, that was fabulous. And we really appreciate you ending up with that slide that showed us how to contact you. And you should know right now, we are going to be contacting you because we know that our children need this help and parents need the help for themselves as well. So not only are we trying to cope with the challenges of health, but as we also recognize, health also is dictated by the climate, the environment that we are in. So families, we are looking forward to right now, we're going to have a discussion about climate change. And we're really pleased to bring Maggie Stritz, pardon me, Kanin, if I'm mispronouncing that, please take my apology. And she's here to talk about the Healthy Air program that's part of Southwest Detroit's environmental vision. Welcome, Maggie.
Thank you. I appreciate the opportunity to be here and talk with you about this topic. And yes, I'm with Southwest Detroit Environmental Vision, and I am so pleased to be with this organization today and sharing out information about the climate crisis, healthy air, and what's going on locally to help combat climate change and deliver results here for our residents and with our residents. On the slide, you'll see some information about our organization and our mission. We've been working since 1991 on air quality and the other issues that you see on the screen. And one of the things that we work to do is really bring collaboration to address the sometimes conflicting priorities between residents and small businesses and the industrial neighbors that exist here in Southwest Detroit. In addition to smokestack pollution, we also experience a significant amount of mobile source pollution. Now, this slide shows that the human species as a whole puts 152 million tons of chemicals into the air every day. We cannot continue to treat the atmosphere as though it is just a place where pollution disappears. And we also cannot continue to push the cost through healthcare burden onto residents that is truly a cost of doing business. On this slide, you'll see a rough handful of pollution sources that exist in Southwest Detroit. I won't list them all verbally, so you can check those out at your own leisure. But as these exist, I want to also emphasize that Southwest Detroit is a vibrant, fantastic community that is bearing the brunt of this so-called economic value that the activities on the slide represent. So we need to work together to move forward solutions that can help to reduce the impact of this pollution. Now, some of you may recognize the image here on the screen on the top left. One example of some of the pollution that is real problematic for public health is particulate matter, and that is an acronym PM. So it's considered fine particulates. These are particles that are 2.5 microns and smaller. So you see on the bottom right picture here on the slide, what the size that we're talking about, these pink spheres that fit within these blue spheres that are shown against the size of a human hair and a grain of sand. These enter the bloodstream and can cause significant health problems, which again are listed here on the slide. Now, you may remember PM Dawn. That was a musical group in the 90s. Are they fine? Yes. Are they awesome? Yes. PM 2.5, it's fine. It's real small. It is not awesome. It's very dangerous. And this is something that we have to address in order to improve the health of our population here in Detroit and the natural environment. In the interest of time, I'm going to move on. Now, it was mentioned in a previous presentation that there are disparities around deaths and serious cases of COVID-19, and it's certainly in part tied to that implicit bias that was discussed, no doubt. Also, we need to talk about the air pollution burden and other pollution burden that contributes to increased risk. And so when we talk about the climate crisis and air pollution, it's a public health crisis and a natural resource crisis. This pollution is damaging our planet as well as our public health. This slide shows the temperature increase over time. And what we're seeing is that this last year, 2020, was the hottest year ever, tied with 2016. And this is not the hot or not rating that you wish to see. We need to see more temperate increases or very limited increases, if any, in temperature. So what we're working to do is decrease air pollution to keep that heat rise in check. Now, while the atmosphere is warming up, this heat that's trapped is also warming the oceans and water bodies like the Great Lakes. That means that there are more extreme rainfall events. But what's crazy about this is that it also happens to contribute to extreme periods of drought. And we're seeing that in Detroit. Longer periods without rainfall, and then very concentrated, severe rainfall events that cause flooding and seriously impede our way of life here in the city. So solutions. There are things that have been happening in Southwest Detroit and across the city, doing really what Detroiters have been doing for decades, working together to make a way out of seemingly sometimes no way. What we're doing is cutting greenhouse gas pollution while working with folks on the ground to mitigate the impact of climate change now. And you see some examples on the slide. We're reducing tons of emissions each year by working with diesel fleets to replace their vehicles. We're working, as you can see, with decision makers to make sure they know about the importance of pollution controls for public health and environmental health. We're working with businesses to get them to participate a little more consistently in mitigating the impact of pollution. And we're seeing some results potentially over the next year or two with indoor air filtration units at homes and schools. And this is done collaboratively, all our work with and for residents, with academic institutions, with public agencies. I want to mention this last bullet point here in particular for this audience and this forum, because we really want to welcome and invite young people who are listening today to participate with us. We have opportunities to intern, to have part-time jobs in the summer or other points in the year to start leading today on these challenges. So really, please use your voice, your vote, your choices. Speak truth to power in these topics like your world depends on it, because your world does depend on it. And we've got ways to address this now. And I'm so proud of Southwest Detroiters, Detroiters as a whole, and Metro Detroit beyond for walking with us in this movement to address climate change and air pollution.
Thank you. Thank you so much, Maggie. Reminding us that we can think global, but we can absolutely focus and make a difference at the local level. And thank you and the community in Southwest Detroit and Community Solutions, Southwest Solutions for working on that. Christine, unbelievably so, this program has zoomed by and we are at the end of still another COVID-313 Community Coalition Town Hall. Let's see, I think we have several different announcements. I'm handing it to you. It was a blessing to be part of this wonderful event again today.
Well, thank you, Jametta. This has been a really, really amazing, an amazing town hall. And I'm going to wrap us up quickly because we're at the 1:30 mark. And we just want to remind everybody that and thank our panelists and remind everybody that if your question was not answered today, we will get answers for you next week and we will post them on onedetroitpbs.org and on DPTV's Facebook page. Those of you that heard who is eligible for vaccines, teachers, people over the age of 65, those working in the city of Detroit and still have to go into your office, ministers, school teachers, please set your appointment to get your vaccine. And please continue to practice social distancing and wearing your mask. We can get through this together. We're in the last 6 miles of this marathon, it feels like. So please reach out to the Detroit Health Department if you have any questions about this. This town hall is truly a group effort. So before we go, I'd like all of our partners to turn their video on. And we want to remind everyone to stay healthy, stay powerful, and stay strong. Christina, could you please say that in Spanish?
Manténgase fuerte, manténgase saludable y manténganse empoderado. Gracias.
Thank you. Everybody have an awesome rest of the week and weekend. We'll see you next week.
Take care, everyone. Stay safe, stay strong.